So welcome to today's forum on drug pricing. I'm Ceci Oregon. I'm the Executive Director of the Institute for Health Policy, and I'll be the MC for today. At the Institute, we host events and publish information to shape policy and practice on important health topics like drug pricing. Before we dive into today's program, I'd like you to please take a minute to pull out your phones and participate in an audience poll. So please register for the poll by texting Health Policy 261 to 22333 or by visiting pollev.com/Health Policy 261. So our first question for the day is, what are you most interested in hearing from today's speakers? So if you could take a minute to let us know. The speakers are here in the room with us and hopefully thinking about the comments that they're going to see shortly on the screen. So text Health Policy 261 to the number 22333. Okay, give you a second to do that. And again, the question, what are you most interested in hearing from our speakers today? All right, why don't we take a look at some of the responses? Hopefully we've gotten a couple so far. Solutions. Explaining why certain drugs are priced so high. Actionable policy options to lower launch prices, value-based pricing. How will MFN impact drug pricing, IRA, policy recommendations for high-cost drugs, path forward, absolutely. That's what we're hoping to talk about today. Multi-stakeholder agreement, fair prices and fair access, how to navigate the changing federal environment, KP insights and solutions. We'll absolutely be talking about that. What's fair? Great. These are wonderful. And I'm asking our speakers to just take note of a few things that you've heard here so that we can address those during the course of the conversation. So we will be digging into a lot of the issues that are being shared right now. And let me talk a little bit about our agenda. So we'll start with a panel discussion about the root causes of high U.S. drug prices. And then we'll move into a panel explaining what influences drug prescribing and utilization. And we will be talking about Kaiser Permanente's approach in this session as well. We will then break for lunch at noon. And in the afternoon, our final panel will focus on what's happening right now, and will feature the perspectives of experts in policy and economics. And then we'll close the day with a few reflections. So I also want to thank folks that submitted questions in advance. We've shared those with the moderators and some of the speakers, and our hope is to both address some of those asked questions and to make some space for a few questions today after each panel. So a little bit of housekeeping, though, before we get started. The event is being recorded. So I'd like to ask folks to please take a second to silence your telephones, your phones. And if you have to take a call, I ask that you please take it outside, or if you need help finding a quiet space, please let some of our staff or folks standing in the back of the room can help us get you accommodated so that you can take a call quietly. To access information for today's event, there are cards on the table that have information about both the Wi-Fi here at the Center for Total Health, as well as a QR code that will link you to the webpage with the agenda and information about each of our speakers. If you're using social media today, we'd ask that you mention us using our handle at KPIHP, and certainly hashtags like #drugpricing would be welcome. We'd love to see this conversation spread on social media as well. And then a final note, our restrooms are located behind the screen. and down the hall and to the left. And in case of any emergency, there's an exit right behind you. And staff again will be here to help navigate anything that might come up in that way. So to start our program off, I would like to invite Tony Barrueta, Senior Vice President of Government Relations for Kaiser Foundation Health Plan and Hospitals, to the stage to provide some opening comments. As many of you know, this is Tony's last forum in official capacity. We are thrilled that it's on the topic he cares so much about. His hard work and dedication to address drug pricing on behalf of Kaiser Permanente and our over 12 million members, as well as the communities we serve, has been incredible to watch. Let me share that Tony has been with Kaiser Permanente for over 30 years. He's overseen our legislative and regulatory policy efforts and led a team of legislative advocates and policy professionals. He's directed the development of policy positions across a range of topics that are easy, like drug pricing and Medicaid and Medicare and you name it. These policy positions have supported KP, our members, and the broader community. He's also a member of the board of directors of the Alliance for Community Health Plans and the California Latino Economic Institute, and he serves on the statewide leadership council for the Public Policy Institute of California. Now let's turn to Tony. Thank you.
Well, thank you, Ceci. And lovely to see everybody here to spend a day talking about my favorite subject. So we didn't exactly plan it this way, but I'm super delighted that having a session with all of you talking about drug pricing is how I'm bookending my time at Kaiser Permanente. First I want to thank Ceci, thank you, and thank the Institute team for really putting on a series of incredible events. These forums on a variety of different topics really are unique, I think, and for the last 7 or 8, 10 years, we've been having events on drug pricing, on mental health policy, on a whole range of topics that are designed to bring people together with some diverse views, but also around people with a lot of common ways of thinking about things who don't naturally come together. And I think in the drug pricing space, we've done that for quite a while. It was about almost exactly 10 years ago, we had an event in this space. We had our labor management partnership at Kaiser had a collaboration that we called the Partnership for Quality Care. And at that time, which was in 2015, we put on a session that was sort of similar to this about what is going on with drug pricing, what is underneath it, why are things happening the way that they're happening. And it in some respects, it was the vision that came out of that event that led to our program of Kaiser Permanente Institute for Health Policy forums that have been going on since then. And every single one of them has been fascinating. Every single one of them has been well attended, and I think it's fair to say that those have had an impact over the last 10 years on creating a core of people around a series of issues who care about things and come together. So, Ceci, thank you, and the rest of the team for carrying that out. Thinking about today's session, I was trying to pack 30 years of history into like 4 minutes of reflection that I can offer around this. And in thinking about it, I was actually thinking about the first project I did for Kaiser Permanente was actually before I joined Kaiser Permanente, when I was still in private practice, and I prepared Kim, one of your predecessors, to testify at the Energy and Commerce Committee on the issue of Medicaid best price. And what happened at that hearing was really quite fascinating, and I think a lesson on how things have played out since then. The ranking staff and member at that hearing, right before Al Carver, who was our pharmacy director, was to testify, brought up a video. He rolled a cart out with a TV and a VCR on it, because that was what you did in 1994, and it was and basically showed a video which was a Sacramento local news article around Kaiser Permanente's management of a new Alzheimer's drug called Tacrin, Cognex, that was newly on the market. And because Kaiser Permanente does what Kaiser Permanente does, which was look at the evidence, make sure that the drug can come into practice in the appropriate way, the pharmacist would look at it, the physicians would come to an agreement about how it should be used, and the decision was made to have it be a non-formulary drug used by exception instead of having it on the formulary. The manufacturer of the drug didn't like that, so there was a campaign which in part led to this news report. That experience really reflects exactly how prescription drug policy has gone forward for the intervening 30 years. There are a lot of complicated policy issues that require understanding and require discussion, and too often those conversations are cut short by anecdotes that don't tell the story of what's really happening. And I think we have seen that through the entire stages of what's happened in drug policy since then, whether it was, around that time, how was pricing to be regulated for the Medicaid program. Eventually we got to Medicare Part D, we got to the ACA, we got, you can go down the list. And then whenever new drugs have come onto the market, there have been flashpoints at this time. And around just before we had the event here in 2015, we had the whole, frankly, from my standpoint, the debacle of how hepatitis C drugs rolled out and what the pricing levels were for that. So last night, Anna Kaltenbach and I were having a conversation about what's happened to pricing, really since this time. And one of our partners in this work, who unfortunately can't be here today, Aaron Kesselheim, has long scheduled events that I think are preventing him from being here, but he's been to many of these events and always been fascinating. A couple of years ago, they did some work on looking back at launch prices and net prices over time. And interestingly enough, 2015 was one of the points in time that they looked at, but they started in 28, and the median launch price for a drug in 2008 was about somewhere in the range of about $2,500 for an annual course of therapy. By 2015, the launch price was $10,000. So this was a couple years after Sovaldi was launched at $84,000. By 2021, it was $180,000. And by 2022, it was $222,000. So, and I think we had this conversation, and Anna's response was, we've failed in all of this effort of what's been going on. And I really don't look at it that way. I think what we have been doing is we have been casting light on the underlying dynamics of why something like that is possible. And we have been uncovering policy solutions on what should be done going forward. And I think that's part of the reason why we're still having these gatherings and these meetings, because there is a lot of hard work to do going forward. And many of the people in this room who you'll hear from today have been doing critical, pivotal work to help uncover this. I mean, Tahir is going to be speaking about what's going on in the patent system. IMAC's work has been really groundbreaking and remarkable what's happened in that space. Anna's work, basically shining a light on what the investment dynamics and the market dynamics are in the market have been outstanding. And so there's that's just two examples. I could go around the entire room and point out the work that everybody's done. Christie's, work leading on drug negotiation and how all of that has played out. So there's just an incredible amount of critical work that has gone on that will continue to have to go on. And so, I have one of the things the team knows me. Thank you, Ceci. One of the thing the team always prepares wonderful remarks for me, and then I never use them, and I just say what I'm going to say. And so we're sort of in that mode right now. But I do think there's a couple of thoughts that I did want to share on just reflections on everything that we've seen. And the first one is that drug pricing is basically political. From the time I was in private practice and representing drug manufacturers when I was here in Washington, and our role was helping them understand what the political and policy responses would be to the choices they made about how they set the prices for their drugs, We saw that with the Finance Committee report about the hepatitis C drugs. It's very clear what kind of public pressure comes on the drug companies has a massive influence. And unfortunately, their capacity to relieve that public pressure through misdirection has been extremely effective. And that's part of why we've seen this climbing of launch prices over time. And I should say it's also been net prices. I mean, during that period in 2015, 2008, the net price was like about $1,400. In 2021, it was $160,000 compared to launch price of $180,000. So much of the conversation has been about the supply chain and how the market is kind of screwy. And we've talked a lot about how the market is a little bit screwy. And we've compared how Kaiser Permanente with its integrated system is different from how the disaggregated market operates, and why that allows us to be a little bit more effective in terms of how we manage prescription drugs and deal with the drug companies. But it does not explain how you get to a $222,000 launch price in 2022. This conversation needs to continue to happen. Another one is, there's no one right way to do anything in life. And there is no one right way to finance the development and bringing to market of prescription drugs. And there is a deep assumption that the way it exists now is the way it has to exist, and if you touch it, everybody's going to die. And that is simply not true. There are more effective ways to bring products that are not being brought to market, and that needs to be explored by policymakers and people in this room. I think the central question, and Tahir's work really shines a light on this, is how should public goods be made available to the public for their benefit? And what we have is a system right now that is politically, it seems untouchable, but the policy behind it is very clear. There are major policy issues that people are hesitating from taking on because the thinking is so ossified among policymakers. But this group and people like it, and the people who come to talk about these issues, are exactly the kind of people who can break through that ossification and bring new thinking. And given what's happening and the costs of healthcare in general, the cost of prescription drugs, there is a reckoning coming, and it will be required to have solutions in this space. So that's what we're here to talk about. And while I will not be in this role at Kaiser Permanente, I look forward to showing up here with the rest of you and continuing to think about these things as we go forward. Okay, so I spent way too much time just blathering, as I always do. And I do want to say thank you again, everybody, for being here. I do want to turn it over to our first panel. So Dan, Tahir, Lee, Christy, please come on up.